So write it down. It is consist of corpora quadrigemna. ঠিক আছে, স্যার অলরেডি পড়িয়ে দিয়েছেন, জাস্ট আমি ফটোটা দেখিয়ে দিচ্ছি। ঠিক আছে, এই স্ট্রাকচারটা দেখতে হবে। ঠিক আছে, ট্রান্সভার্স সেকশনে এই স্ট্রাকচারটা দেখা যাবে। এটাকে টুগেদার কি বলা হচ্ছে? ব্রেন স্টেম। ঠিক আছে, তো ব্রেন স্টেমের মধ্যে কি দেখতে পাচ্ছি আমরা? এটা মিড ব্রেন। সো মিড ব্রেনে কটা কলিকুলাই আছে? সুপিরিয়র কলিকুলাই, ইনফিরিয়র কলিকুলাই, রাইট? হোয়াট ইজ দিস? এটা কি? This is the pons. Okay, other name for pons is known as bridge. Okay, actually it is bridging together, and downwards you are having the medulla oblongata. Okay, now see this structure we will see here today, the pons. আমাকে বল কোন কোন cranial nerve কোথায় কোথায় লোকেশন আছে? cranial nerve এর কোথায় কোথায় লোকেশন আছে? cerebral hemisphere is related to which nerve? 1 and 2. 3 and 4 is found where? 3 and 4 are found in the midbrain, and in the pons you are having the 4 nerves. Okay, so what are the 4 nerves? 5th, 6th, 7th and 8th, right? So among them you are having the 5th one, that is known as trigeminal. Trigeminal এর কটা root? কটা root? কটা? দুটো রুট। ওকে, একটা সেন্সরি, একটা মোটর। হুইচ ওয়ান ইজ দ্য মোস্ট লার্জার? একটু বুদ্ধি করে বল, কোনটা লার্জার হবে, সেন্সরিটা না মোটরটা? মোটর কাকে সাপ্লাই করে? ট্রাইজেমিনাল। দ্য মাসেলস অফ ম্যাস্টিকেশন। আর চারটে মাসেল কি কি? অ্যান্টেরিয়র বেলি অফ ডাইগ্যাস্ট্রিক, আর মাইলোহায়োয়েড, আর দুটো কি? আর কি রে? আর দুটো? চারটে মাসেল আছে। মাসেল অফ ম্যাস্টিকেশন হয়ে গেল। ঠিক আছে, অ্যান্টেরিয়র বেলি অফ ডাইগ্যাস্ট্রিক হলো, আরেকটা? আর দুটো টেন্সর বেলি প্যালেটিনি, টেন্সর টিম্পানি। ওকে, টোটাল 8 মাসেল। সো এইটুকু জাস্ট অনলি সাপ্লাই করে the motor, the muscle. What about sensory? It has got 3 root: V1, V2, V3. V1 is known as ophthalmic, V2 is known as maxillary, and V3 is known as mandibular. So this sensory root is too much large. Okay, so here you could see এই এরিয়াটাকে কি বলে? This area, if you see the pons, এটা কোন অ্যাসপেক্টে? anterior view, ventral aspect, তাই তো? এই এরিয়াটাকে কি বলছে? basilar sulcus, right? So why we will call it is basilar sulcus? Because basilar artery is going through. Remember, basilar artery is going through. I told you what is the blood supply of brain? Blood supply of brain ki? Which is the two chief major artery of brain? One is the branches of the vertebral artery coming from posterior side. Another one is going from here, from common carotid artery, that is known as internal carotid artery. Understood? Two arteries are there. So among them one is vertebral artery. Vertebral artery kota part করেছে স্নেকে? হার্স বল, কটা পার্ট vertebral artery? চারটে পার্ট। ওকে, there are 4 part of vertebral artery. Vertebral artery মানে কি? ভার্টিব্রা দিয়ে যাচ্ছে, রাইট? So এই vertebral artery টা it will divide it into 2 basilar artery. Okay, so this is the group for basilar artery. ঠিক আছে, so just if you go on the this side, both side, you will see some kind of eminence. এই জায়গাটা একটু swelling আছে, right? So this is known as medial eminence. Okay, আর এটাকে বলছে তোর medial sulcus. ঠিক আছে, medial sulcus or basilar sulcus. Next to that you are getting 2 swelling, that is known as medial sulcus. তারপরে আবার একটা সালকাস পাওয়া যাবে, this is known as sulcus limitans. কি বলছে? sulcus limitans. Okay, and if you go further this side you will get another swelling, that is known as facial colliculus. Okay, and lastly you will have this 4 nerve. What is this nerve? এই পার্টটাকে কি বলে? medular. আচ্ছা, তো ওখানে পন্স পড়ানো হয়েছে না? ব্রেন স্টেম পুরো পড়ানো হয়েছে, তাই তো? পুরোটাই পড়ানো হয়েছে, তাহলে তো বলতে পারবে এই জায়গাটাকে কি বলছে, মেডুলার এই জায়গাটাকে কি বলে, পিরামিড। ওকে, so just pyramidal above you could see this green color nerve that is known as abducens nerve. Okay, abducens nerve. So next to it you could see another nerve that is known as trigeminal nerve and facial nerve. Okay, so which nerve, another nerve that is coming from cerebropontine angle. Okay, between the cerebellum and pons there is one angle, from that one nerve is emerging having two roots, that is known as vestibulocochlear nerve. Understood? So here you are getting how many nerve? See, this one is the cerebropontine angle. Okay, and this is the vestibulocochlear nerve. What is these two nerve? কে বলবে এটা? এটা কোন নার্ভ, এটা কোন নার্ভ? এটা কি জায়গা, এটা মিড ব্রেন, তাই তো, মিড ব্রেন। সো দিস ইজ দ্য oculomotor nerve and this is the trochlear nerve. Okay, it is coming from the posterior side. Okay, so this thing already I told. Pons se ki porbe, basilar sulcus. Why? Because basilar artery is going through. Okay, and it is dividing the pons into two halves. মাঝখানে basilar artery যাচ্ছে, দুদিকে দুটো half হচ্ছে। Okay, now there is also some fibers are running. If you see the pons, you will see so many transverse fibers are running. So this is known as cerebellar peduncle. Okay, cerebellar peduncle that is going to the cerebellar hemisphere. Okay, আর কি আছে, originate from the pontine nuclei. So main important thing in the pons, you will get the pontine nuclei. Okay, so pontine nuclei across the midline and it also pass through the contralateral middle cerebellar peduncle. You know which peduncle is related to the pons? Middle cerebellar peduncle. So that fiber should be going to the contralateral. Okay, that means it is decasseting. যে পন্টাইন নিউক্লিয়াই গুলো পাচ্ছি সেগুলো প্রত্যেকটা ডেকাসেট করে কোথায় যাচ্ছে, মিডল সেরিবেলার পেডাঙ্কল। ওকে, and this is just opposite to the cerebellar hemisphere. Okay, so see, this is the picture of pons. So I told what is this, this is the pyramid of medulla oblongata. Okay, and what is this, this is the basilar sulcus. Okay, then next see, if you see over here, there are numerous transverse fibers that are coming from the pons which is going to the cerebellar hemisphere. Okay, so that is known as pontocerebellar fiber. Okay, and if you see the two root of the fifth cranial nerve, so fifth cranial nerve eta ki nerve, ki root, motor root. Just now I said motor root will only supply the 8 muscle, right? And sensory root, see, sensory root of trigeminal is too much thick. You could see it is too much large. Facial ta ki hobe? If you see the facial, it is just reverse. ঠিক আছে, facial এ তুই যদি এখানে দেখিস, it is just reverse. Which one would be smaller, which one would be large? এটা তো facial nerve বেরোচ্ছে, তাই না? এটা কি? This is the pyramid of the medulla. Just above that you are having abducens nerve, right? So এই সাইডে যদি most laterally you will go, you will get two root of the facial nerve. একটা হচ্ছে তো সেন্সরি, একটা হচ্ছে মোটর। সো কুড ইউ টেল মি হুইচ ওয়ান ইজ সেন্সরি? একটা স্মল আছে, একটা লার্জ আছে। একটু বুদ্ধি করে বলতে হবে, ফেসিয়াল নার্ভের কোন রুটটা লার্জ হবে, থিক হবে? ফেসিয়াল মাসল সাপ্লাই করছে যেটা, সেটা মোটর রুট, রাইট? সেটা ম্যাক্সিমাম মাসলকে সাপ্লাই করবে, ইট উড বি লার্জ। Then what about the sensory supply of facial nerve? Very good, that is the anterior 2/3 of tongue. একটা হয়ে গেল, taste sensation। আর কি, আর কোথায় সেন্সরি ডিভিশন পাবি ফেসিয়াল নার্ভে? lacrimal gland, tearing. Okay, so that is that sense also by the facial nerve. Okay, so if you go most laterally, you will see another nerve that is known as vestibulocochlear nerve. Okay, so tell me, among the all cranial nerve, which are pure sensory? Pure sensory 12টা নার্ভের মধ্যে পিওর সেন্সরি কোনগুলো? 1, 1 to 8, ঠিক আছে? And tell me which are pure motor? হ্যাঁ 3 4 3 এর কোনো সেন্সরি সাপ্লাই নেই? oculomotor nerve. What about the pupillary reflex? Pure motor কোনগুলো? Spinal accessory, hypoglossal, yeah. And so 11 and 12. Then which are the pure motor? Abducens. सिर्फ एक को ही सप्लाई करते हैं trochlear. Okay, so 4 6 11 12. 4 6 11 12, these are the pure motor. And tell me which are parasympathetic? 3 7 9 10. 3 7 9 10. How will remember in physiology which are vitamin K dependent pathway? Clotting pathway, vitamin K dependent. কত? 2 7 9 10. ওকে, ওখানে হচ্ছে 2 7 9 10, এখানে ক্রেনিয়াল নার্ভটা হচ্ছে 3 7 9 10. ওকে, so এখানে you could see there are two root. One is small medial motor and lateral large sensory. So which one is the most larger? That would be sensory for trigeminal. Then there would be abducens. So we could see sulcus between pons and pyramid. Okay. Okay. See in this picture, this is the pons. Okay, and this is the basilar artery. Okay. So now another thing, there are two sulcus. Okay. This one is the superior cerebellar sulcus. This one is the inferior cerebellar sulcus. So which artery is going through? Last bench. I told you, if you see the pons, two surfaces, one is superior, another one is inferior. So there are two arteries that are running on the superior surface and inferior surface. Which are they? It's very easy. ওপরের দিকে যেটা যাবে সেটা হচ্ছে superior cerebellar artery, এই যে সালকাস এটা দিয়ে, and below তে যাবে inferior cerebellar artery. আর throughout the midline there is basilar artery. Okay, these are the relation of the artery to the pons. Okay, so facial nerve and another one is vestibulocochlear nerve. So see here, this is which portion? Anterior or posterior? This is ventral view of pons or dorsal view? So this is the dorsal view. Ventral view hole which thing you could able to see? The floor of fourth ventricle. Okay. If you are seeing the sulcus of floor of fourth ventricle, that means it is ventral aspect. And if you are seeing the medulla, that means it is the posterior aspect. Okay. So now we will see the dorsal surface. So see, this is the dorsal surface. So getting the dorsal surface, what you have to do? You have to take out the cerebellum. Because this midbrain, pons, medulla oblongata pichone ki ache? Cerebellum. So you have to cut the section. Okay. So in between that you could get one rhomboid fossa. So this is known as floor of the fourth ventricle. So in this also you have to see so many structure. What are they? Number one, what is this sulcus? I told this is the median sulcus. Okay, fourth ventricle কিন্তু বারবার আসে, ঠিক আছে? The floor of fourth ventricle is very much important, so you should know the structure. মাঝে আছে medial sulcus, both sides is elevation, these are known as medial eminence. Okay, on beside you could also see that is known as locus coeruleus. Okay, locus coeruleus. And here is the facial colliculus. এখানে কি হয়? Here is one incident that is known as neurobiotoxis. Okay, neurobiotoxis এ কি হয়? These nerve nucleus are facial. It should be just beside the abducens. একটা জিনিস লক্ষ্য করেছেন? It should be just beside the abducens. মানে 6 থাকবে, তার পাশে 7 থাকবে. But instead of we are seeing the 7 is in between. Okay, and 6 is on the lateral side. এই ফেসিয়াল নার্ভ নিউক্লিয়াসের নিচে এখানে there is known as inferior surface of genu of sensory root of facial nerve. Okay, inferior surface of genu of sensory root of facial nerve. এটা কিন্তু explain why তে আসে বারবার. Okay, why there is facial colliculus present in the midline and why there is elevation. Okay, so neurobiotexis এ কি হয়, this facial nerve nucleus they will just cross the abducens nerve nucleus and they will limit on the median sulcus. ঠিক আছে, ওকে ক্রস করে মিডিয়ান সার্কাসের দিকে আসে, this is known as neurobiotexis. Okay, so that's why it is swelled up. So now if you see just beside you could get another sulcus, that is known as, just now I said, that is known as sulcus limitans. Okay, and if you see that towards the lower portion of the pons, you could see there are some transverse ridges, okay, that are going on the transverse root. These are known as striae medullaris. These are known as striae medullaris. Okay, so these are the thing you have to elaborate of the floor of the fourth ventricle. Okay, so these are the thing already I have discussed. Median sulcus ki, median eminence ki, sulcus limitans ki, vestibular area and facial colliculus. দুটো নার্ভ নিউক্লিয়াই বলতে হবে, একটা হচ্ছে ফেসিয়াল আর একটা হচ্ছে ভেস্টিবুলো-কক্লিয়ার. ওকে, so this thing only, and this is what, this is the stria medullaris. Okay, so see, this is a specimen you could see. Okay, so what are the structure you could see? What is this? We are seeing from the superior aspect. Okay, so superior aspect, what you could see, this is the basilar sulcus of Pons. এটা কার সাথে কন্টিনিউ হয়? with the crus cerebri of the midbrain. Okay, ওর সাথে কন্টিনিউ হলো, right? And you could see on the by side there are two nerve are going. Number one, which is most largest one, that is the trigeminal, right? Then you are seeing the abducens and facial, both are together. Okay, facial টা আগে যাবে, তারপরে abducens. Okay, then this is the basilar sulcus of the pons. So this is the superior view. Now this is the dorsal view. So dorsal view, what are the thing you could see? এটা কি হচ্ছে, third nerve nucleus is coming out, that is the oculomotor. Okay, and here you could see the basilar sulcus, very nicely seen. So this is the basilar sulcus of the pons, which is continuing the anterior median fissure, which is continuing through the anterior median fissure of medulla oblongata. Okay, and if you see on the medulla, there are two things. One swelling that is known as pyramid. Just beside that there is another swelling that is known as olive. Okay, so one is pyramid, another one is olive. Okay, so this is what they have taken out the cerebellum, right? And this is the floor of the fourth ventricle. Okay, so this thing already you have seen, just see the specimen. So if they have cutted the bridge, so that is the cerebellar peduncle. Okay, superior cerebellar peduncle and inferior cerebellar peduncle. Okay, so now if you see the pons, it is divided into two parts. One is anterior part, that is known as basis pontis. Okay, basis pontis, and posterior part টাকে কি বলে, tegmentum. What are the part of midbrain? Who will tell? Midbrain এ কি কি part আছে? কে ছিলি শনিবার ক্লাসে? মিডব্রেনের পার্ট কি কি জয়শ্রী বল, মুখটা লুকাচ্ছে, বল কি কি পার্ট আছে মিডব্রেনের? অ্যান্টেরিয়র আর পোস্টেরিয়র কি কি পার্ট আছে বল? ক্রাস সেরিব্রাই আছে. ইফ ইউ গো অ্যান্টেরিয়রলি কি পাবো? টেগমেন্টাম. মোর অ্যান্টেরিয়রলি উই উইল হ্যাভ টেকটাম, রাইট? and there is one duct that is known as cerebellar aqueduct. Aqueduct of Sylvius. Okay, so কোন পার্টটা এটাতে কন্টিনিউ করবে? tegmentum. Okay, tegmentum of midbrain, it will continue with the pons, and there is one structure you could see, one again another swelling that is known as trapezoid body. Okay, trapezoid body you could see. Okay, So it consists of acoustic fibers of cochlear nuclei ascend into midbrain to lateral lemniscus, terminate in the inferior colliculus. So who will tell the auditory pathway? Ear হয়ে গেছে, auditory pathway কি করে যায়? Hearing has come to your ear, right? So at first it will cross the tympanic membrane, then to the internal ear. Okay, internal ear থেকে কি নেবে? Organ of Corti. Okay, organ of Corti. From there, where it is going? Organ of Corti থেকে কোথায় যাবে? Midbrain. It is going to the midbrain. Through where? Through the lateral lemniscus. যখনই lateral lemniscus পাবে তখন পাবে medial geniculate body. Okay, just opposite. আর যদি এটা তোর ophthalmic pathway, visual pathway তে কি হবে? Just opposite. তার মানে ওখানে কি হবে? medial lemniscus, lateral geniculate body. Geniculate bodyটা lateral হবে, but lemniscusটা medial হবে. Okay, and finally where it is going? Inferior colliculus. The visual pathway and auditory pathway along with diagram is very much important. Okay, please draw. আজকেই বাড়ি গিয়ে দেখবি কি করে auditory pathway যাচ্ছে, কি করে visual pathway যাচ্ছে. Okay, one by one. So see, this is the cross section. So cross section of this pons has been by two. Just like midbrain, you are having superior colliculus, inferior colliculus. এখানে দুটো লেভেল কি কি হবে? একটা লেভেল হবে superior cerebellar peduncle, আর একটা হবে middle cerebellar peduncle. Okay, so there are two levels. So here you have to say all these things. Okay, what is reticular formation, what is the medial longitudinal fasciculus, these all stuff you have to say. Here is also two cross section. Okay, so this is the auditory pathway. Remember we told about the trapezoid body. So trapezoid body is related to the ventral cochlear nuclei. Okay, so it is related with the auditory pathway. Okay, see, this is the auditory pathway, right? So কি করে যাচ্ছে? প্রথমে organ of Corti, then cochlear nuclei, right? Then what is this? Superior olivary complex. From that nucleus of lateral lemniscus, from that inferior colliculus, medial geniculate body, auditory cortex. Okay, this thing we have already discussed. Okay, so see, this is another cross section of the midbrain and pons at the level of the inferior colliculi. Okay, so this is would be your assignment today. Please draw the diagram, the cross section of the two level of the pons. Okay, repeated time the question used to come. Okay, same from the midbrain, same from the pons. They will ask you, please draw the diagram of transverse section at this level and elaborate the structure. Okay, তাহলে midbrain আর pons হয়ে গেল, right? So see, this is the trigeminal nerve. So you could see very thick nerve root, ophthalmic, maxillary, mandibular. Okay, আর একটা ganglion থাকে, that is known as preganglionic, that is cisternal segment. Okay, so this is the same thing. In between the pons and cerebellum there is fourth ventricle. So here you are having the floor of the fourth ventricle. Okay, let's go. ওইখানে চল দেখিয়ে দিচ্ছি ডিসক্রিপশনে। So we have covered midbrain and pons. Next we will do the medulla oblongata and the two lateral ventricle. So it will complete your neuroanatomy.